Well, this year's United Arab Emirates Health Foundation Prize went to a Filipino doctor for her work helping out mothers and their newborns. Let's get to know Doctor Maria Asuncion Silvestre here on The Final Word. Doctor, thank you so much for joining us and congratulations on your latest achievement.
Thank you. Good evening, Rico, and thank you very much for having me.
Doctor, you designed a pioneering protocol called Essential Intrapartum and Newborn Care. What are the salient features of this initiative?
Okay, some may say that it wasn't really that innovative, but in terms of execution and implementation, it required a health policy change, and of course, the evidence to back the policy change. So that we can easily understand what needs to be done in the first few minutes and hours after birth, we describe the protocol, so to speak, as a rapid sequence of time-bound steps. For example, after a baby is born, the first step to take is really to immediately dry and the infant, after removing the wet cloth, the infant is put in skin-to-skin contact so that the mother's own body can provide the warmth necessary for the baby's body to thermoregulate, it's called. Only after the baby's in early skin-to-skin contact and the pulsations in the umbilical cord stop is the umbilical cord clamped and cut. And after that, the baby is left non-separated from the mother in skin-to-skin contact so that the first life-saving breastfeed can be completed successfully.
So,
that
Doctor,
in a capsule.
So, Doctor, how many unnecessary steps did you eliminate from the after-birth process?
There were a couple, because before we implemented the protocol, we looked into time motion studies of almost 500 deliveries in 51 government hospitals in the Philippines. And we found that one of the first actions was, for example, the doctors or midwives or nurses would routinely suction the baby's mouth and airway. So that was eliminated. Early bathing was eliminated. The immediate clamping of the cord was delayed so that the pulsations, which bring warm placental blood from the placenta to the baby, was delayed so that babies were coming out much warmer, much more stable, pinker, and thus much more equipped or free of breathing distress so that they could complete the first breastfeed.
There have been a lot of benefits with this pioneering protocol that you have introduced, Doctor. How does this recognition help and assist in your advocacy work and in the country?
Yes, we have used the evidence to policy to practice mantra. And so it's not just guidelines as to what health workers and in particular skilled birth attendants should do. We required that we raise the visibility so that behavioral change, not just from families, but also from health workers, be implemented. Kaya going around the country, having this visibility, being able to amplify the voices of newborns who really don't have voices, and mothers, especially in remote facilities all over the country, will benefit largely from this amplification.
And Doctor, how many countries have already adopted your pioneering protocol, Essential Intrapartum and Newborn Care?
I can only speak objectively for our Western Pacific region of the WHO that consists of countries of the East Asia and the Pacific. And in our Western Pacific region, there are 9 priority countries at the very least. There is a reference to that 17 other countries are already implementing these simple steps to saving lives of both newborns and their mothers.
And how many hospital and medical institutions in the Philippines are adopting this pioneering protocol, Doctor?
I don't have an exact number as of today, Rico, but all over the region, it's at least 10,000 facilities already. And when we say facilities, that means even rural health units in our provinces, in our remote areas, toward up to district hospitals and even in tertiary exclusive hospitals in Metro Manila and other metropolitan areas in the Philippines.
Doctor, we are really very proud of you and your achievements for the health of mothers and newborns. Congratulations. And thank you so much for joining us on The Final Word. Yes, Doctor.
I accept on behalf of the team. Thank you, Rico.
United Arab Emirates Health Foundation Prize recipient, Dr. Maria Asuncion Silvestre.